Hello. Good
Hi there.
afternoon.
I just muted myself because I realized I'm probably like ding dong for everybody every time they try to come in.
I always wonder that. Can people hear the sound that, like, as a host, you guys hear that? Okay.
I don't know if I've ever noticed.
Like you just heard that sound right now?
Oh, that one I didn't hear. No.
No.
Oh, okay. Then it must just be on mine. I was like, oh gosh.
I think it's just the
Yeah.
host that hears.
Yeah, that makes sense.
Oh, well, welcome everyone. I am in complete denial that it is May 1st because I'm like, there's no absolute way that is. So I'm like, cannot believe we're meeting today. But let's hope that spring might actually be here with May. I'm not confident, but I'm hoping. Um, so bear with me. Unfortunately, Sue Ellen had got called to a mandatory meeting up at Cayuga, at the hospital and is unable to be here. So I had to be honest, put aside and not really prepared. So it probably won't look any different than normal, but here we go. I just thought we'd have kind of a an opportunity to connect and do some more of the networking, but so we'll start and have a go around. And in the go arounds, I just want to more hear about some of the exciting things that people are working on, if there are any events that are coming up. I think we're all familiar with the services that we provide. If somebody isn't, they can, raise their hand and ask. But for the most part, we just want to share what we're working on, and then I'm excited to say we'll actually have updates from Andrea and Athena because our work groups are meeting and things are happening. So that part is exciting. And then if we still have time at the end, let's be positive and talk about what's going well in the community and around and things that we see, and then talk about some different opportunities to collaborate. I just think it'd be great to have some positive energy floating around. So I'm just going to open it up and ask to do a go around and what's happening.
I'll start.
Yay.
We have an easy one. I'm Karen Bullis, by the way. I'm the deputy at the Office for the Aging. Our annual luncheon is May 15th at the Hotel Ithaca from noon to 2. We have a very lovely speaker joining us this year. It is Miss Karen Brown, whom we're all familiar with. Um, but we're going to be speaking about advocating for yourself in the healthcare system. Um, May is Older Americans Month, and the theme this year is Champion Your Health. So that aligns quite nicely. So, having said that, all are welcome to join. I have to have the final head count to the hotel by Monday, so there's still time. If anyone is interested in attending, please reach out to me and I can get you the information. That's it.
I have a couple events to share. My daughter's homesick, so you might hear children's toys in the background. Since Allie Evans from FoodNet is not here today, I'll do a little plug for the Mac and Cheese Bowl. It is coming up on Wednesday. I believe that's a Wednesday. Yes, Wednesday, May 6th from 4:30 to 7 p.m. Probably a lot of us will be there tabling at the non-for-profit information booths. So Love Living at Home will be there. It's all of the proceeds from the Mac and Cheese Bowl benefit FoodNet Meals on Wheels, and you can try like 100 different kinds of mac and cheese. So you can buy tickets right on their website. And then 2 days later, once your stomachs have settled from all the mac and cheese, Love Living at Home will be having our annual volunteer appreciation celebration. So that is Friday, May 8th at 5 p.m. at the large pavilion at Stewart Park. We will have drinks and refreshments, and it is open to the public and free, and we would love to have you all join us.
Sounds fun.
I could go next. I'm Andrea Davis, one of the Aging Services Specialists here at the Tompkins County Office for the Aging, and I do not have any announcements. Well, I was going to announce the mac and cheese bowl because I will be there eating a ton of mac and cheese. I'm also lactose intolerant, so it's going to be a fun day. That's all.
I guess I can go. Let's just wrap up our office here. I don't really have an event. There's a couple new initiatives that are coming out from the NYSOFA that we'll be sharing soon. Just some opportunities for people to join a couple different things that are happening. But anyways, I just wanted to mention our move, which we're still kind of in limbo about. We think we're a little bit closer, and it looks like it's going to be more into June at this point. I don't have a date, which is the most frustrating thing. But when we do, Karen will be putting all sorts of public information out, and it'd be great if people could share that. So through their channels, so people understand where we are. But we're thinking probably not May at this point, more into June. We've had to order some new furniture and things that are taking some time. So let people know we'll be moving to Dutch Mill at some point, probably more like June though.
Where is Dutch Mill?
It's up off of it's Warren Road, right past the airport.
Oh,
If you keep going down, it's like the second right past there. It's after. I don't know what the roads are.
I can look it up
But
on
it's,
the-
yeah,
it's
past the
Google
airport after the landing strip there. It's like on the right, so up in Lansing, but it's technically an Ithaca address.
Thank you. Just drawing a blank with that. We can either popcorn or I can call on people. Okay,
I'll
okay.
go.
Okay, great.
Yeah, so my name's Matt, and my computer doesn't do the visual thing. Either that or I haven't figured out how to make it work. But I am the new ombudsman, or one of the two ombudsmen. And I don't really have any announcements or anything. Just that's
Well,
why I'm here.
great. Nice to have you.
Thank you.
I'll just go next because I think I'm the last one from our office. I'm Amy Jackson. I'm also an aging services special. Oh, I'm sorry. I think I was muted. I'm Amy Jackson. I'm also one of the aging services specialists at the Office for the Aging. And I don't have any announcements.
Okay.
I can go. I'm Jan Lynch. I'm the executive director at the Finger Lakes Independence Center, or FLIC. I'm kind of filling in for Ben, who isn't on right now. And probably any information that's relevant will come from Brenda, who's heading up our Department of Health grant to help people who are using CDPAP services.
Hi, Jan. Hello, everyone. Some of you I've already met. My name is Brenda Pape. I'm the new program manager at the Finger Lakes Independence Center. As Jan mentioned, heading up our Department of Health grant, which provides wraparound support services to our consumers from the CDPAP program. And this is helping them to create goals and care plans that help them to be successful in their independent living. I have with me today two of our new support specialists, Shelby and Sheldon. One of our goals that's really big for this committee is falls prevention. So I just wanted to put some faces with our names and get a little introduction there. And it's nice to be with you all.
Great. Welcome. So I'm going to be the annoying health literacy person that I am. Can you tell us your acronyms? Like, not everybody might know what the grant stands for and things along those lines.
Yeah, sorry about that. Thanks, Karen. To clarify, DOH is Department of Health. There's a grant that is providing support for the Consumer Directed Personal Care Assistant Program. These are, it's a program that serves people with disabilities or the older adults who need a care provider, like a personal home care aide or a personal assistant. And those are Medicaid funded programs.
I will add that we have CDPAP too, but that is not Medicaid funded. So just to clarify that for folks, there's that a little bit of an outlier that thankfully Flick is our fiscal intermediary for that. So thank you.
Great, thank you.
Jan, I think you're trying to say something, but you're on mute.
I was just saying the name of what Lisa was mentioning, but it's an acronym and I'm not sure I can always remember. It's called ISEP.
Yes.
So EISEP.
It's the Expanded In-Home Services for the Elderly program. It's a state-funded program. So it's a different funding stream, same program idea as the Medicaid CDPAP program, but just a different funding stream. Different eligibility rules too.
Yeah, it fills a lot of gaps for people.
It does.
Great. Thank
I
you.
can introduce myself. I am Brittany Thorpe. I'm a care coordinator with the Cuga Health Partners care coordination team. We're an arm of the Centralis Health System, and we work and are engaged with the local primary care offices.
Welcome.
Can do a HSC update as well. So Nicole Zulu, Director of Health Planning at Human Services Coalition. A few updates I wanted to provide. For those who are not on Medicare yet, which I know is most of the population, for those who have Essential Plan 200-250, which are health insurance navigators at HSC enroll individuals in, for those whose income ranges between 200 and 250% of the federal poverty level, that plan is going away July 1st. So people have to enroll and choose a new plan between May 16th and June 15th. And our navigators are like already getting booked up for almost that entire time. So if anyone you work with, you hear has that plan, please send them our way and we will do our best. They're going to be switched over to a qualified health plan. Unfortunately, that will look like a lot more financial burden on them, basically, by switching to these plans. So it is an unfortunate thing that is happening. I also want to make sure, I know some people in this Zoom are familiar with the SNAP work requirement changes and the collaboration that's created the Tompkins Opportunity website, which I'll link here to help individuals who are navigating those SNAP changes and see if they might have an exemption or not. And then through this website, they can find training and volunteer opportunities. We are also working with this website eventually to take into consideration the Medicaid work requirements, which will go into effect January 1st of next year. And then I think the last thing I wanted to mention, which again, many people in this Zoom are members, is our Community Health and Resource Network. So there's a link to the network page there. There's a self-screener on that page. So if you are not currently part of the network, which we are at 25 organizations right now, that link will get you to a self-screener that anyone you serve can get in connected to network partners and connected to basically any social care needs, as well as potentially get you into primary care through Cuga Health Partners. I know that we also had some discussions about adjusting the self-screener and maybe ways to help our long-term care committee work, like it falls, and maybe if someone's going in and getting them connected through the screener to those who can help address some of those needs. So that's some work that we've talked about as well, is adjusting this to fit the population we serve. That's all I have for today.
Thanks, Nicole. Even if you don't have any like announcements, it would just be great for two reasons. It helps me too with the making sure I don't miss anybody on our attendance, but also it's just nice for people to get a face and a name to see who's joining us. And I'm sorry for the introverts who that really makes squirm. If you haven't had a chance.
Yep. Can everyone hear me?
Yes, Samantha, we can.
Okay. Hi. Sorry. I was
Okay.
on the phone. Yeah, so my name's Samantha Felice. I'm the director of social work at Kendall at Ithaca. I don't really have any updates, but hi everyone.
Hello, thanks. Let's see. So if you haven't, I'm going to give it a last call out to say maybe
Hi.
Bill. I see he's gone off of mute. Maybe.
Yeah, I'm trying to get there.
Hi, Bill.
Hi. I'm Bill Gilligan. I'm with the Health Planning Council, and as an old person, I'm interested in all the topics we're covering. But I have no other information to share at this point. Thank you.
You're welcome. Thank you.
I did forget to mention one thing. Maybe some of you at the Office for the Aging have heard, but unfortunately, Ben Bassett, who's our New York Connects person, will be leaving soon. He wants to move back to Syracuse, where he has family that have some health issues, so he wants to be available to them. So we're really sad about that, but we are trying to get someone else to fill that position. But I just wanted you to know because he may not be at the next meeting. He hasn't given us a firm date yet, which is nice. He's still around. Thanks.
Thank you. I hadn't heard that, so that's good to know. Thanks, Jen.
We wish him well.
Yeah.
Is there anyone here from Visiting Nurse Services? I'm drawing a blank. I know that Sue Ellen had said somebody might be joining, who could update.
That is me. I'm sorry. I'm trying to join from my phone, which is why my video is not on. And I'm driving and trying to unmute and do all of that at the same time, and it was not working well. So if you give me just a second, I'm trying to pull into a parking spot so I can actually do this properly.
Okay. No problem.
I got stuck in traffic and then I couldn't get my phone to unmute. So I think I've got it now. Okay. So you may hear my GPS in the background because I just made it mad. Okay. I will see if I can provide you a video. I've never done Zoom from my phone. So let me see. Okay, hi. So my name is Cheryl Matthews. I work with Sue Ellen at VNS. And I did not know she was going to be here today. So a little bit caught off guard at myself as well. So my current project with VNS, my announcement would be we were awarded a grant back at the end of last year that we are working to get our contracts finalized. And it's called Capable, which the first part of that is community aging in place. So better living for elders is the rest of that. And so once we get our contract finalized, which we're hoping is also going to be, well, now that it's May, this month, but definitely by June, we are diligently pursuing it. We will be then offering services to elders in the community that are Medicaid eligible. So usually the income type of things. And the purpose of it is to then meet with them in their homes with an occupational therapist goes out and then a nurse also goes out, which will be me. And then we have a handy worker on our team and they meet with people, identify goals that they want to work on to keep them in their homes. So it's promoting their independence. So, if they're having issues with, if there are, fall risk things we look at, we're going to look at medications, but then we're also just going to see, what would make independent living at home be more practical, easier for them. So some certain home modifications, no major renovations, but other things, like if they've got a loose carpet or they need a railing put up, they need a light put in because they can't see in the hallway at night. Or one of the common examples is, somebody who now has to sit down to cook their meals, installing like a mirror over the stove so they can still see what's going on in the pans on the stove when they cannot stand there to cook anymore. So really it's meant to do a lot of working with the person, seeing what they would really need to keep them independent. There's, a small budget involved in that to, any maybe adaptive equipment or things that they might need. And then my background is in care management. So obviously making sure that they are connected to other resources in the community to keep them independent as well. So we've sent some information out. Some of you may have seen it. I've been trying to hit up some of these meetings as well, put a face to the name. And we would also love to give a for sure start date. And we don't have one yet either. So we're ramping up. We're getting, the name and the information out there, refining what we're going to need, so we can let everybody know for referrals and when we can actually get it started. So that is going to be our exciting announcement. And I hope to very soon be able to, say, hey, we are ready to go and we're going to start seeing people. So that is kind of the new thing at VNS that I'm involved in.
Very cool. Does anyone have any questions for Cheryl on that? Because it's kind of exciting stuff.
Yeah, I mean, we really are, like, it's because we've been waiting so long to get everything finalized. It's kind of like, we're real excited in the beginning and then we're waiting and now we're starting to get excited again because we actually are getting closer to our actual launch time frame. Like I said, we can't give a date yet because they haven't given us a date. So if anybody's ever worked with a state grant, you'll fully understand. So once they get everything they need and we'll get it all finalized and then we are ready to go. So looking very forward to, working with everybody.
What's the age range for this?
So as a general guideline, the purpose behind the program, so Capable was actually developed by Johns Hopkins University School of Nursing. And so it's in other states, but this is the first time that it's now being offered in New York State. And I think there's 7 agencies altogether, counting us. And so they say elder. We will have some discretion to that. So as a general, we say, like 60. I don't think that's necessarily going to be a hard and fast rule. We are kind of screening people now as young as 50. And then certainly, if there were somebody maybe younger, individual case by case basis. But in general, because it is meant to be for elders living at home, we're kind of saying 60 years old, 60 and older. And they do not have to have active Medicaid at this point. It's just an eligibility criteria.
Do you see this being like a different population than those living in like the Ithaca housing, like McGraw or Titus, or is it different than
some overlap because they do not have to own their home in order to be eligible for the services because it's not, strictly speaking, home modifications. If there were any modifications, we would have to get approval of a landlord and any things like that. But strictly speaking, they don't have to own where they're living. So even if they are in an apartment or a trailer or they're renting somewhere, they can still be eligible to participate in the program because it is ideally about goal setting to keep them independent, and it's where they're at. So we have previous working relationships with a lot of Ithaca Housing and Titus and stuff like that. So we will still be working with them. But yes, there's going to be some overlap, but it is not. It's not going to be limited to one or the other.
Great, thanks.
Thank you.
Yeah, thank you. Didn't mean to put you on the spot and make you stop, but that was really good information.
Well, I already had an appointment scheduled, and then she sent me the invitation for this meeting yesterday, and I went, well, I can do it. I said, I'll probably have to jump off a little bit early, but then I got stuck in traffic, so I wasn't parked yet when the meeting started. So I was like, well, I delayed my introduction as long as I could, and I'm on the parkway, so I just had to find someplace I could actually pull off on the parkway.
Well, great.
I'm
Thank you
safely
very
in the
much.
parking lot. We're all good.
And hopefully we'll see more of you.
I hope so. Yes, that is the plan.
That'd be great. Annie, do you want to jump on? I saw that you popped in.
Thanks, Karen. Yeah, I'm sorry I'm late. My name is Annie Perry. I'm the service coordinator at McGraw House, which is affordable housing for seniors 62 and over on Geneva Street downtown.
Thanks. And do you have any announcements or anything exciting going on at McGraw or anything?
No announcements today.
Okay.
Always encouraging people to apply, though our wait list is very long. We have a preference for veterans and surviving spouses of veterans, so those folks do get in much more quickly if anyone's working with that population.
I just bumped into somebody who was talking about they had a appointment coming up to come. They had put their name in for McGraw House, so that I said, "Oh, you'll meet Annie." So, anyways, well, great. Unless anybody else wants to go, I think I might now switch and put Andrea on the spot and ask if she can talk to the group about the falls prevention. And obviously, too, Andrea, it's not all on you because you have other group members, but you've been the one that I say prayers and thank you for taking the leadership role of facilitating that and getting me updates and stuff. So, if you're in a spot, Andrea, I'd love to hear more about what's going on.
Yeah, thank you, Karen. So we actually met yesterday, and something that's kind of in the works, I believe it's the Center for Aging Resources and Enrichment at Lemoyne College. They do fall prevention programs and caregiver training workshops. So that's something that the Human Services Coalition now has a contract for. So we're looking at planning for that possibly later in the summer, sometime in the fall, and we're looking at the fall prevention training being located at Flick in their conference room. That's still something that we're working on, and they have a lot more parking than we do downtown. So, and then with the caregiver training workshop, looking at possibly having it in our new space, but we're still all in the planning process or stages for those two things. We're meeting again May 27th at 2 p.m. We're looking at having a space, some type of SharePoint or Google space where we can have all of the historical data on falls, the previous work that was done by the Falls Coalition, and kind of breaking that down and reviewing it, looking at what we have in place, what's working, maybe adding to it. So things are just kind of just in the works, but we have some things coming down that'll be great. So. And we have some members on today, so if you want to add anything, please feel free. But that's all I have.
I want to throw a shout out because it's May, and just as a heads up, because I feel is that there's the Fall Prevention Month, and can't remember if it's September.
It is.
But I just want to throw that out to the group because Beth always gets me and then I'm always behind. And so I just wanted to be ahead of the game for once and say I haven't been able to come to the group, but that would be something as well to think about with your programming, which I'm sure you already did.
Can I just piggyback on that, Karen? So just throwing this out, which I know you all know, Lisa and Andrea, but we will be hosting our second startup Senior Living Expo in September, where we have had, last year we had Ann Riley and her physical therapist do assessments for folks, which was extremely popular. So perhaps there's something we can do to highlight the month of September, but also keeping that piece of the expo there too. So just a suggestion.
Yeah, thank you.
A great one. Did Jess Taves get a hold of you guys for the fall prevention group?
Yes, so she is traveling for the month of May for a few different life events. So she'll be catching up in June.
All right, just wanted to make sure. She had told me that she was interested in connecting with you guys, and I just wanted to make sure that it happened.
Yes.
Okay, great.
And I was just gonna share that I've been in contact with the care program at Lemoyne about the trainings, and they're proposing Wednesdays in July and August. So I don't know if that really worked with the time frame you guys talked about.
That's perfect.
Yeah.
Yeah. Okay.
That's
Okay.
perfect.
They said that they basically have like earmarked Wednesdays in July and August for Tompkins County. So Andrea, when you and I meet Monday, we can hammer a little bit more of those details out.
It's awesome.
Okay. Awesome.
Great.
Super. Anybody else or any questions? Or, I mean, the other nice thing is that it's exciting that the group is off and working on it, but it's also a nice opportunity to be able to come back and open it up for the larger group if we want, to have a conversation around falls prevention. So here's your opportunity. If there's not, then we can move along. But I want to see this be a part of our regular quarterly meetings, is not only hearing the feedback, which I have to say I'm so tickled to hear about all the progress that's going on. So that's fantastic. But if anybody who's not had a chance to attend had any questions or thoughts or conversation, we have time if you want.
I guess I'll just say, Karen, that, maybe this is something that Cheryl would like to be involved with too, is the working group, since they are doing the Capable program. And, our office does a very similar program, but it's non-Medicaid clients where it's actually Andrea and Amy are certified aging in place specialists, and we do the Falls Home Safety Assessments along with that. Going out and kind of doing the same things that Capable does. We just don't have the medication management and the occupational therapist, but we're able to connect them to minor home modifications and minor home repairs, for that matter, with our program with INHS. So it's the handyman, but we contract that out. So we're doing similar things. So it'd be great to maybe align and to make sure we're not duplicating things in the community, and just, it's just helpful when we're all on the same page.
I would love that.
Okay,
because
great.
the other part of my job is sustainability, because we are on a grant. So
Yeah.
eventually, the money goes away, and one of the goals of this, when we finally get started, is how to make it sustainable. And I actually had looked into some of the things that INHS was doing, because I was noting, similar to some of the things, but we all know that funding and trying to get things actually covered can always be an issue. So I would be thrilled to join in on that and,
Great.
see what we can do together.
Great. Thank you.
I
And
will put my email in the text box here too, now that I'm parked. So
Thank you. I know that, I'd mentioned I see Sue Ellen's here now too, and we had, kind of talked about this when she was applying for the grant. So it'd just be great. I think it's a perfect space for us to all be connected in that way.
I'm glad you brought that up. I was thinking that, and and I think not only is it, I think, really positive and gives us the opportunity to build these collaborative and really make the most of our efforts, but I think it also helps us be able to communicate it and talk in the community to others about what's going on and what the differences are, things like that. So I think it's great. Thanks for bringing that up, Lisa. Super. Well, I am excited that we've actually got some stuff going on. So thank you for all the hard work. The stuff that's happening doesn't happen by itself. It happens by us putting the efforts in. So I know everybody's workloads are high, but this is exciting to see the collaboration going on. So thank you.
yeah. Yep. Thank you.
Dina, do you want to rock us with your accomplishments and the stuff that's going on there?
I guess we'll see.
Well,
Um,
I'm
I-
excited. I see stuff all the time coming from you, so that's fantastic.
Yeah, I do have some updates for the transition work group. We have sort of officially shortened the name to just Transition Planning Work Group. And we have had, let's say, 2 meetings. So we last met in April. We did come up with just kind of a very short summary statement to explain what the committee does or the subcommittee does. So we have just stated that the transition planning work group will address and identify discharge needs and propose solutions. So we're just, trying to give kind of a clear explanation. And then if anyone has further questions, I'm happy to share any of our committee resources or minutes. We do now have a recurring time and date. So we will officially be meeting the second Wednesday of each month at 1 p.m. on Zoom, with the exception of November for Veterans Day. So thank you, Nicole Zulu, for pointing that out. We are kind of hoping that each meeting is focusing on the challenges by, I guess, sort of a different category. So, for example, for May, we're looking at challenges that are faced by health places. So, for example, Veronica Smith will be presenting on May 13th to talk about the discharge process at CMC. So we'll be focusing on challenges from the CMC perspective. And then in June, we'll be focusing on challenges that come from places like VNS or other care providers agencies. So we're sort of breaking out challenges by different categories so that we can collect them and then work on solutions once we have sort of all angles. And if you did not receive the email with the invitation for the next meeting, or if you would like me to send over the calendar invite that includes the link for all following meetings, please just let me know.
Fantastic. Any questions or conversation from the larger group or thoughts?
I'll just chime in that there is a lot of real negative stuff going on in the world around us, especially toward funding changes that might affect older adults. I watched a video that was in preparation for a seminar that's going to be in a couple of weeks, and it was super depressing about the care economy. But hearing what you guys are doing and hearing you all come together, it just gives me a ray of hope today. So thank you very much. Keep doing it. Keep doing it. Thank you. Thank you.
So, I just want to put my 2 cents in and just say what a great idea about having a different focus or a different area each month, because it can get really bogged down, if you look at one area or whatever. But I think that sounds like a really great thing. And is it all right if somebody's not on the committee to just pop in to hear those presentations, or is it better to have just the smaller group that are at those? What's the group's thought on that?
My preference would be to have as many people as possible because everyone has different perspectives and different challenges. So I think, I guess the key players from all the specific individual conversations is great. So, for example, having medical providers in May, having care providers in June, but I'd really love as many people to join us as possible.
Great. I just thought I'd ask because sometimes, when you get too big, it's challenging. But then sometimes if you don't have, it's easier too if people come and hear at times so you don't have to then just, get all the information back out again. But so I just wanted to make sure of that. Any other, I also think, I hadn't thought about it, and then when the conversation and the suggestions came up around the name change, I do think it makes a big difference, and I think it'll make things a little easier to address and makes it a little more comprehensive. So I think there's a lot of great things going on, and I just want to give a shout out to both Tina and Andrea. I'm just the amount of like detail and sending in updates and the meetings and stuff. It's really nice. So thank you. You're both doing a great job on that. Well, if there's not any other conversation around that, I kind of wanted to, in the kind of the vein of what Allie just shared about how there's a lot of negative stuff going on in the world and a lot of impacts. Every time I hear about another cut or this or that, it is hard not to go down that rabbit hole. And so I thought, let's talk about in this meeting, though, some things that are going really well in the community, with folks that you're working with, even in your own departments, your own agency, if you want to share something, because I think being able to hear other good things helps lift the energy up and keep maybe some momentum going. So I just wanted to give some time in the meeting if people wanted to share about some things that are going well.
I'd be happy to start, Karen.
That'd be great.
Thank you. Well, at Flick, with the new grant that we have through the Department of Health, we've been able to establish a new satellite office in the South Hill Business Campus, and we've hired new staff. So we've expanded our support specialist staff that are doing home visits, and these home visits to our consumers are really, proving that we're able to get out there and provide additional services and supports and help people with some needs that we weren't able to, not that we weren't able to, but we have a greater capacity to do now. So it's something I feel worth celebrating.
Exciting. Is there anything that we as a committee or a group can do to help support you and your new staff?
Well, in the conversation today so far, I've heard some really interesting things. For example, there is a lot of cross collaborative ideas that come to mind because of similar activities that our different agencies are doing. So I do see some interaction and cross collaboration, as Cheryl has the Capable program, and then as the Office for Aging has the other service programs. So a lot of the grant goals are similar to other activities happening here from other service providers. So there might be a way to talk about that overlap and how we can coordinate and collaborate.
Great.
I have a project I can talk a little bit about. I feel like I've talked a lot today, but some of you may be familiar with the wellness series that happens every summer in the Ithaca Community Gardens. That will be returning in 2026, and we're joining as a community partner on that as part of our intergenerational gardening program that we're partnering with Southside on. So for the wellness series, it is free, it is open to the public. It will occur Tuesday evenings from June 2nd to July 21st. And Cayuga Health Systems, specifically Laura from CMC and Centralis is kind of the key coordinator on it. So she started it 2 years ago now, and it's just kind of growing, and more agencies and organizations are hopping on to create this beautiful event that is free to all ages within our community. So we'll have more, I guess, invitations and information soon.
That sounds great. Is there like a you just said you'll have more soon. Is there a place to see like is there a topic each week? Is it like a different topic?
So it's sort of a choose your own wellness adventure. So from 5:30 to 6 o'clock, there's snacks and health screenings from Cayuga Health. And then from 6 to 7, you can choose your own wellness adventure. So you can do either a walk with Bike Walk Tompkins, you can do a yoga class with Yoga Farm Ithaca, or you can do an educational workshop of some kind that will sort of rotate each week. So every week you can pick a different activity.
That's exciting. Lifelong does a lot of stuff, and I'm sure you're connected with, Liza and those folks over there with getting the word out. But I also wanted to say that there's a women's support group that's led by one of their members, Dolores Dewberry. And she has a listserv of over 60 women who kind of come in and out of this group on a semi-regular basis. They usually have about 20 ladies who meet every week. And that might be a connection too, to be able to get the word out. So if you need that down the road, let me know, or send it to me and I'm happy to send it along to Dolores. She amazes me how they get the word out and how much those folks are doing in the community.
That would be great. Thanks, Karen.
Yep. Anyone else have anything that they'd like to share that's been going well? Or excited that that you're working on it? Annie?
Yeah, I guess I'll just give a shout out to Hospicare. They just did in-home services for a 103-year-old resident. He recently passed away, but they just do such a beautiful job. And that might be a presentation for the transitions committee to consider too, and how hospice, both at the King Road location and in-home services, really provide such an extra level of support and care for patients and for their families. So it was a really, really wonderful experience for everyone. And we don't have a centenarian at McGraw House anymore, I'm sad to say.
Oh.
Got a few who are close, but our 103-year-old recently passed away.
Did anyone have a chance to go to the Talking About Death Won't Kill You last weekend?
Well, that's a great question.
I ended up going, but if anyone else did, I won't speak until you have a chance to.
I did not go. It's Angela, right?
Yeah.
Yeah, she used to be part of this group and
Yeah.
she was part of the transitions group
Yes.
too. So that, that might be a perfect segue into what Annie's talking about.
Yeah. So I feel slightly guilty. My wife wanted to go, and I said, "Oh, I got so much to do, and do you know how many of those I've been to?" But then my guilt won over, and we went down. And they did a nice job, and it's one of those reminders again that we have to keep doing these things that we've done over and over again because different people need it at different times. So for me, I'm happy that I went because I had kind of thought like, oh, I know this stuff, kind of a thing. But I learned new things while I was there. And one of the speakers was talking about the new law that was passed about the medically assisted, I'm going to get the wrong term, but the medical assisted.
And dying.
Yes.
Yeah.
And that it won't be in place until August. But I want to say it's really great that this has occurred, that the people will have this option. And I want to say, though, it's not a simple process from what the speaker was talking about. And so if you hear of anyone or are working with folks that think that might be something, it's not something to put off right to the last minute because they have to have a diagnosis and two signatures, I guess, or two doctors to confirm. They have to see a mental health person. Like, so there's a bunch of steps. And then the person also, what I didn't realize, has to be able to actually do the administration of or taking the medicine themselves. Like, you might be able to mix it up for them, but they have to be able to do that. So I thought, oh, that's something that a lot of people probably won't know. The statistic that they mentioned was very low. I think it was less than 25% of people even know it's been passed or something like that. It's a really small number. And then the other statistic, I'm forgetting again, but it was a large portion of the people who get approved actually don't go through with it. It just was this big relief that they have it there and if they need it. So it's a really great peace of mind that was there. Um, what else was so I found that really useful. The the hard part though is if anybody has like a dementia or a type of disease that impacts cognitive, it's not going to be an option because they have to be able to have that cognitive assessment and that they're in sound mind, and it has to be within 6 months. I think they have to have a diagnosis of less than 6 months. And I could be wrong, so don't take me as the authority on it. It just was nice to hear some new information and see new faces that were around and giving information, as well as some older faces like Angela, who's really committed. And they have a death cafe. I don't have it in front of me. I didn't anticipate even talking about this, but there's a death cafe that's coming up as well. All right.
We'll
Anyone?
say the hospice care staff, as they were in and out, mentioned they're working really closely on this and trying to make sure there's good teams in place to help people with resources. So if it was something this committee or people wanted more information about, they would be a good local resource. And then the New York Statewide Senior Action Council just did a whole training on it as well. So that was also a good resource. And they have a tab on their website with all their resources, and that presentation was going to be archived, and it was very, very informative. So that's probably up by today.
If you send me the link or the little blurb, I'll get it in the notes.
Okay, yeah, I will, because I was going to try to look at those slides or keep them anyway. So I will send the link to you. Thanks. That's good.
Thank you. Anyone else have something that you'd like to talk about that you've seen in the community or that's going well? Well, I just wanted to make sure we had an opportunity to be able to talk about things that are going well and that we're seeing. And then we've got about 8 minutes, I guess. Did we go to 1 or 1:15 on this, Nicole? And
We
something
block off till 1:15
okay.
in case we need the.
We don't have to stretch it out. I won't make you stay to that. But so we have time though that we can open it up that if we haven't had a chance to talk about if there are other opportunities to network, we can throw that out there. Or if people just have, I think, a conversation, something that they think that the long-term care committee should be aware of, things going on or those type of things. Oh, I think then if we don't have any other topics, I won't, like I said, I won't make you have to stay just for the sake of stretching out to the end. But if anybody has any suggestions around agendas, I'd love to hear feedback if this type of format is working okay. Do people miss having a speaker come in? Because I know that people had talked about missing the opportunity to hear what people were doing and networking and those type of things. So that's why we stepped a little away from having a speaker. But if anybody down, wants to shoot me an email or let me know, I'm always looking for ways to make these meaningful. And Sue Ellen is also just got pulled away today, but she's also our chair, and so she'll be doing the meetings as well. So it isn't always just me blathering along at you. So Thana, I'm glad you talk and you're saying stuff because then people don't have to hear just me ramble on. So thank you.
Can I just say one thing, Karen?
Yeah.
So, as speaker opportunities, like, that sometimes does feel like it's missed a little bit, but we usually do our Aging Service Network meetings. That's something that we haven't done because we were supposed to be moving for the past 9 months. So we kind of just, put those a little bit to bed. But going forward in our new space, we're hoping to revive those again. So, if there are topics that people want speakers about, we would be happy to do those at that meeting. And it's the same core group of people that are really Aging Services Network meetings, or the same group that's kind of here. So if this could be more focused on provider and connections and networking that way, we could fill the gap with interesting topics like what Annie was talking about, having a hospice presentation, or those kinds of things would be really helpful there. So I just want to put that out there that we could share. If people are missing that, we're definitely going to be starting that. We could fill that gap there.
Great. That's an excellent idea. All right. Well, everybody enjoy that first weekend in May, and I hope May goes well for everybody. It always seems like that goes by fast and a lot of things are going on. And I am drawing a blank about when our next meeting is. Gosh, I'll send it.
August.
That's what, yeah, I was gonna say it seems like it's forever away. In August. So I guess I'll say enjoy your summer, a lot of it, and I hope to see a lot of you down at the Mac and Cheese, and hopefully it might be a little warmer than it has been, but I love it down at the farmers market. It's a lot of fun. So enjoy, everyone.